Heart disease, also known as cardiovascular disease, is a condition that affects the heart and blood vessels. It is one of the leading causes of death worldwide, with millions of people affected each year. Heart disease can take many forms, including coronary artery disease, heart attack, heart failure, and arrhythmia. Here are some causes of heart disease. 1. Poor diet. A poor diet is one of the major causes of heart disease. Eating foods that are high in saturated and trans fats, cholesterol, and sodium can lead to the buildup of plaque in the arteries, making them narrow and less flexible. This can reduce blood flow to the heart, causing it to work harder to pump blood, which can eventually lead to heart disease. 2. Lack of physical activity. A sedentary lifestyle is another major cause of heart disease. When we do not engage in physical activity, we are at risk of developing high blood pressure, high cholesterol, and obesity, which can all contribute to heart disease. Regular physical activity can help to improve heart health and reduce the risk of developing heart disease. 3. Smoking. Smoking is a major risk factor for heart disease. The chemicals in tobacco smoke can damage the blood vessels, making them narrow and less flexible. This can lead to a buildup of plaque in the arteries, which can increase the risk of heart disease. Quitting smoking can significantly reduce the risk of developing heart disease. 4. High blood pressure. High blood pressure, also known as hypertension, is a condition in which the force of blood against the walls of the arteries is too high. This can cause the arteries to become narrow and less flexible, increasing the risk of heart disease. High blood pressure can be caused by a variety of factors, including genetics, stress, and poor diet. 5. Diabetes. Diabetes is a condition in which the body is unable to properly regulate blood sugar levels. Over time, high blood sugar levels can damage the blood vessels, increasing the risk of heart disease. People with diabetes are at a higher risk of developing heart disease, and it is important for them to manage their blood sugar levels to reduce this risk. 6. Genetics. Family history is a major risk factor for heart disease. If you have a close relative who has had heart disease, you are at a higher risk of developing it yourself. While you cannot change your genetics, you can make lifestyle changes to reduce your risk of developing heart disease. Some people with heart disease may not experience any symptoms. Others may experience a range of symptoms that can affect their daily lives. Here are the symptoms of heart disease. 1. Chest pain or discomfort. One of the most common symptoms of heart disease is chest pain or discomfort. This can feel like a pressure or squeezing sensation in the chest, and it may be accompanied by shortness of breath, nausea, or sweating. Chest pain or discomfort may occur during physical activity or while resting. 2. Shortness of breath. Another common symptom of heart disease is shortness of breath. This can occur during physical activity or while at rest, and it may be accompanied by a feeling of tightness in the chest. Shortness of breath may also be a sign of heart failure, a condition in which the heart is not able to pump blood effectively. 3. Fatigue. Fatigue, or a feeling of tiredness or weakness, is another common symptom of heart disease. This may be caused by a reduced ability of the heart to pump blood, which can lead to a decrease in oxygen delivery to the body's tissues. Fatigue may be more pronounced during physical activity or at the end of the day. 4. Swelling in the legs, ankles, or feet. Heart disease can also cause swelling in the legs, ankles, or feet. This may be caused by a buildup of fluid in the body, which can occur when the heart is not able to pump blood effectively. Swelling may be more pronounced after standing or sitting for long periods of time. 5. Irregular heartbeat. An irregular heartbeat, or arrhythmia, is another common symptom of heart disease. This can feel like a fluttering or racing sensation in the chest, and it may be accompanied by dizziness, lightheadedness, or fainting. Arrhythmias can be caused by a variety of factors, including high blood pressure and other underlying medical conditions. While heart disease cannot be cured, it can be managed through a variety of treatments. Here are some of the treatment options for heart disease. 1. Lifestyle changes. One of the most important aspects of treating heart disease is making lifestyle changes. This may include eating a healthy diet, engaging in regular physical activity, quitting smoking, and managing stress. Making these changes can help to reduce the risk of further damage to the heart and blood vessels. 2. Medications. There are several medications that can be used to treat heart disease. These may include blood pressure lowering medications, cholesterol lowering medications, and medications to prevent blood clots. Your healthcare provider may also prescribe medications to manage symptoms such as chest pain, shortness of breath, or irregular heartbeat. 3. Medical procedures. In some cases, medical procedures may be necessary to treat heart disease. These may include procedures to open blocked arteries, such as angioplasty or stenting, or procedures to bypass blocked arteries, such as coronary artery bypass surgery. Your healthcare provider will determine if these procedures are necessary based on your individual condition. 4. Implantable devices. Implantable devices may also be used to treat heart disease. These may include pacemakers, which help to regulate an irregular heartbeat, or implantable cardioverter defibrillators, ICDs, which help to prevent sudden cardiac arrest. Your healthcare provider will determine if an implantable device is necessary based on your individual condition. 5. Cardiac rehabilitation. Cardiac rehabilitation is a program that helps people with heart disease to improve their cardiovascular health. This may include supervised exercise programs, nutrition counseling, and stress management. Cardiac rehabilitation can help to improve heart function, reduce the risk of further damage to the heart, and improve overall health and well-being. 6. Dietary changes. In addition to lifestyle changes, making dietary changes can also help to manage heart disease. A heart-healthy diet should be low in saturated and trans fats, cholesterol, and sodium. It should also include a variety of fruits, vegetables, whole grains, lean protein sources, and healthy fats. Your healthcare provider may refer you to a registered dietitian to help you make dietary changes that meet your individual needs. 7. Stress management. Stress can have a negative impact on heart health, so managing stress is an important part of treating heart disease. There are many different techniques that can help to reduce stress, including deep breathing, meditation, yoga, and exercise. Your healthcare provider may refer you to a mental health professional to help you learn stress management techniques. 8. Follow-up care. It is important to follow up with your healthcare provider regularly to monitor your condition and adjust your treatment plan as needed. Your healthcare provider may recommend regular checkups, blood tests, or other diagnostic tests to monitor your heart health. 9. Education and support. Living with heart disease can be challenging, so education and support are important aspects of treatment. Your healthcare provider may refer you to a support group or a cardiac rehabilitation program to help you connect with others who are living with heart disease. Education about heart disease can also help you to better understand your condition and make informed decisions about your health. Thus, treating heart disease requires a multifaceted approach that addresses lifestyle factors, medication management, medical procedures, and support. By working closely with your healthcare provider and making positive changes to your lifestyle, you can manage your condition and improve your overall health and well-being. Remember, if you are experiencing symptoms of heart disease, it is important to seek medical attention right away. Early diagnosis and treatment can help to prevent serious complications and improve outcomes.